Hello, my name is Reyes Argueta, and I chose to do my final sports medicine project on researching the total knee arthroplasty and unicompartmental knee replacement. We will be discussing the surgical procedure, the pros and cons of the procedure, and the 5 phases of rehab. Since the phases of rehab for the TKA and unicompartmental are similar, I will describe the differences of both procedures at the end. A quick summary of the procedure is the surgical team administers anesthesia. Once the anesthesia kicks in, an incision is made at the knee. Next, the surgeon uses a bone saw to remove the knee joint. After, the surgeon proceeds to resurface the bones in order for the new joints to sit in well. Once the bones are resurfaced, the new joint is inserted and tested by making sure the leg can extend and flex. Once everything is in place and ready to go, the surgeon stitches everything back up and the patient now has a new knee. The pros of having a TKA or uni knee replacement is now being relieved of the pain that the patient would feel. The patient would now also have better mobility and an overall better quality of life. Many, if not all, patients have said that they could do things with their new knee that they hadn't done in years. Some cons to the surgery are having a higher chance of major post-operative complications. Obviously, the tissue around would be very sensitive and patients would feel aches and pains, but that would be due to their tissue recovering from the incision. Some patients describe feeling discomfort in the knee, which is not abnormal, especially with the TKA, as you will have other materials foreign to your body in you. In some very rare cases, patients report having persistent pain after 2 weeks that could last months. The first phase of rehab will last from right out of the surgery to the second day out. Doctors will have a seat with the patient and make sure to get them to understand the rehab process that is coming and making sure they understand that they need to be really cooperative with all the medical staff. After that, the patient will start doing exercising without leaving their bed. This is called bed mobility, and it's done to make sure everything is working correctly and to prevent the joint from locking up due to scarring. Patients will also be taught how to use ambulating devices. Patients will get massages done around the knee as well. The goal for these 2 days are to gain equal or less to -10 degrees of extension and 80 degrees of flexion. Phase 2 starts after day 2 and will last up to week 6 after the operation. Patients will now be walking around daily with assistance of ambulatory devices and nurses. They won't be walking for long periods of time, instead a couple feet a day at certain times throughout the day. They will progress to using equipment such as the stationary bike, performing isometric exercises that will target the quadriceps, hamstrings, and glutes. Another exercise they will be doing a lot will be the 4 plane straight leg raises, or SLR. If a patient cannot do these exercises, or not all of them, doctors will use neuromuscular electrical stimulation to get the muscles around the knee firing without having too much movement of the joint. Phase 3 will start after week 6 and will last up to week 12. Patients will keep doing the exercises they've been doing but at a higher intensity. They will be doing more repetitions and add resistance. If patients are ready and the incision is fully healed, patients may now start the endurance program in the pool. They will also start another endurance program by walking longer distances with or without assistive devices. The patient will also move forward and start age-appropriate proprioception and balance exercises. At this point, the use of neuromuscular stimulation on the quads should be stopped. Phase 4 of rehab will start after week 12 and will last depending upon how active or what kinds of physical activities the patient is involved with. They will continue all the other exercises. They will increase the duration of endurance activities and initiate the return to their recreational activities. And that is all for the TKA. The differences of the unicompartmental replacement is done when only one compartment of the knee has been damaged. As only a compartment of the knee is being replaced, the recovery time is shorter and the procedure is less invasive as the TKA procedure. The knee also heals quicker than the TKA procedure. Patients feel their knee more natural, as obviously they still have parts of their knee. After the surgery, most patients can kneel and squat. They will be able to return to their normal lives after 1 to 4 weeks. The full recovery time still is longer, which is 1 year, but is less than the 2 years or 1 year and a half of the TKA. And that is it for my presentation. Thank you for watching.